Hi. Newborn assessment. Newborn assessment includes examination of newborn plus newborn reflexes. Reflexes I have discussed in another video. Please go through that. In this video we will see the normal characteristics shown by newborn along with abnormalities. You know that newborn period is time from birth to 28 days. The vital signs of a newborn: temperature 36.5 to 37.5 degrees Celsius, pulse 100 to 160 beats per minute, respiration 30 to 60 breaths per minute, BP 60 to 75 systolic and 40 to 50 diastolic mm of H. Anthropometry, we have to check four things: weight, height, head circumference and chest circumference. Weight is in the range of 2.7 to 3.3 kg. Height is 48 to 53 cm. Head circumference is 33 to 37 cm and chest circumference is 31 to 33 cm. The chest circumference is less than head circumference at the time of birth. They both become equals at 1 year of age, and later the chest circumference will be increasing. Sensory development. The newborn fixates on objects brought in front of the eyes. So you have to show the things in front of the eyes of the newborn. Hearing is fully developed. Teeth. There is no teeth, or in some babies natal teeth may be present. Language or speech development. The newborn will be crying for different needs. Safety and love need. This is something which we need to educate the parents. Safety and protection from suffocating sleep position, animal bites, falls, burns, poisoning ingestion, accidents and drowning. Love and security must be provided through warmth, support of head and neck of the baby. We need to prevent separation anxiety, develop sensory perception by providing different types of toys, avoid unpleasant taste and avoid painful experience for the newborn. We should educate the parents regarding personal hygiene, bathing, eye care, skin care and appropriate clothing, about regular medical checkup and immunization. Next, education should be on nutrition and sleep need. The baby should get a sleep of 18 hours per day and food should be breast milk, calorie 120 kilocalories per kg per day. Protein requirement is milk protein and the water requirement is 140 to 160 ml per kg per day during the newborn period, and this is slightly less during the first 10 days. Play need. The play need is sense pleasure play. So here you need to hold the baby, touch the baby and rock the infant. And it should be done very gently. Talk and sing softly to the infant at a very close range. Encourage mutual eye contact and provide pacifier for sucking pleasure. So these are the play needs of the newborn. Normal and abnormal features of a newborn. We will be seeing the features, normal and abnormal things. The first feature which we will see is the cry. Usually the baby will be having a strong, energetic and vigorous cry. An abnormal cry is feeble cry. The baby is constantly crying. If there is a hoarseness in the voice, high-pitched sound, if the cry is weak, cry is absent or any other type of abnormal cry you feel. So all this comes in abnormal cry. The second is color. The baby is normally pink in color, and a term known as acrocyanosis, that is also a normal feature. Acrocyanosis means the cyanosis of hands and feet. Just hands and feet will be cyanosed. And if the entire body is cyanosed, that is known as central cyanosis. Central cyanosis is problematic. Acrocyanosis is not a problem. So acrocyanosis is the cyanosis of just hands and feet. Then next is cutis murmurata, that is transient mottling when infant is exposed to decreased temperature. When it is cold weather outside, if the baby is not covered at that time in the skin, something like veins you can see. So this is known as transient mottling and the term is cutis murmurata. And abnormal features: cyanosis, pallor, jaundice, rashes, petechiae, forceps marks. So these are abnormal. Another abnormal features in the color are harlequin color change. So clearly outlined color change as the infant lies on side. We need to keep the baby on the side, then you can find out the difference in color. The lower half of the body becomes pink and the upper half is pale in color. So that is known as harlequin color change. Another abnormality is erythema toxicum, that is a pink papular rash with vesicles seen on the thorax, back, buttocks and abdomen. Erythema toxicum. Another is telangiectatic nevus or stroke bite, that is flat, deep pink, localized areas usually seen on back of neck or any part of the body, usually seen at the back of neck. Telangiectatic nevus or stroke bite. They are flat, deep pink, localized areas. Another is Mongolian spots. They are irregular areas of deep blue pigmentation, usually in the sacral or gluteal regions. It can be considered a normal finding also, and it will be going as the child ages. So these are the things seen in the color. The abnormalities are harlequin color change, erythema toxicum, telangiectatic nevus, Mongolian spot, and cyanosis, pallor, jaundice, rashes, petechiae and forceps marks. About the posture, tone and movements. The baby will be in a flexed position of head and extremities. If there is hemiparesis or opisthotonous posture, this is what is opisthotonous posture, then hypertonicity, that means some tightness in the muscles if you are feeling. Then myoclonus you are finding, that is a quick jerking movement if you are finding, that are all abnormalities in posture, tone, movements. Head. In the head, fontanelles are flat, soft and firm. So you know the fontanelles, anterior fontanelle is there and posterior fontanelle. They are flat, soft and firm. Head lag is common in normal newborn. Anterior and posterior fontanelles are open. We will be telling the fontanelles are closed or open. We will not tell anterior fontanelle present, posterior fontanelle present. We will be checking and telling if the anterior and posterior fontanelles are open or closed. So in a newborn, the anterior and posterior fontanelles are open. So the anterior fontanelle will be closing by 1.5 years and the posterior fontanelle will be closing by 1.5 months. So this is how you need to palpate for the fontanelles. It should be soft with the finger parts. You should not press on the fontanelles. Then the abnormalities. Molding after vaginal delivery. You can see difference in shape. The bones have molded and the shape of the head has changed. And later on, once the child is growing, it will be corrected. So that is molding. Next is craniotabs. Craniotabs means that is the softening of the skull bones. Craniotabs is softening of the skull bones. Cephalhematoma, that is hematoma between periosteum and skull bones. It is hematoma between the periosteum and skull bones, and another is caput succedaneum, that is edema of the soft tissue of the scalp. So caput succedaneum will be crossing the suture line and cephalhematoma will not cross the suture line. There are some other differences also that you will be learning later on in the newborn chapter. So cephalhematoma and caput succedaneum are abnormalities, and one another abnormality is cradle cap. So this is seborrheic dermatitis of the scalp. So these are the features you will be seeing normal and abnormal in the head. Face. No dysmorphic features, that is there is no abnormal shape of the face or not, you need to see. Then it is milia. Milia is distended sebaceous glands and will appear as tiny white papules on the cheeks, chin and the nose. So that is milia. Then another is miliaria or sudamina. So here it is the distended sweat glands or eccrine glands that appear with minute vesicles. So milia and miliaria both are a normal feature seen in newborn. But some abnormal features are cleft lip, low set ears. So you have to measure from the outer canthus of the eye to the occiput, and you have to see whether the ears are low set or not. Another is auricular skin tags. If the child is having this auricular skin tags, further examination is required to see if any other abnormalities are there. Then comes facial palsy. Next is regarding the eyes. Eyelids are usually edematous. There is absence of tears, and this picture which is shown is red retinal reflex. When using an ophthalmoscope, we are observing the newborn's eye. A red reflex is present means that is normal. Corneal reflex, if we are touching with a wisp of cotton, you can see the corneal reflex. Then pupillary reflex, in the response of light you can see. Then blinking reflex also in the response of light or touch you can observe. These are common or normal features in a normal newborn. Then if the child is having purulent discharge, subconjunctival hemorrhages, if with the help of ophthalmoscope, if we are observing and finding absence of red reflex, that indicates congenital cataract. And if we are finding white reflex, that is a sign of retinoblastoma. Now this picture shows hypertelorism. There is a wide gap between the both eyes. Wide set eyes are known as hypertelorism, and if the eyes are close enough, that is known as hypotelorism. Then another term is brushfield spot. This is commonly seen in Down syndrome children. So you can see some spots inside the iris. So these are brushfield spots which is commonly seen in Down syndrome. So this is about the eyes. Then nose. Nose is usually flattened after birth. Nasal patency you have to assess by closing each nostrils. Then you have to watch for oral breathing the child is having or not. That may be because of obstruction by mucus plugs, or it can be because of choanal atresia. Choanal atresia is an abnormality in the nose or the nasal passage in which a bone will be blocking the passage. Choanal atresia. A bone is blocking the passage. Then, if the nasal bridge is low, that is an abnormality. You have to see for the nasal discharge or nasal flaring. You can see this part. This is where nasal flaring can be observed. That's about the nose. Mouth. Mouth, you have to see, open and see the mouth. You have to check if the uvula is in the midline. Sucking reflex, rooting reflex, gag reflex and extrusion reflex, whether they are strong and coordinated. And the babies will be having minimal or absent salivation. So as they grow only saliva will be produced. The abnormalities are like cleft lip inside the palate. When there is a cleft, it is known as a cleft palate. Then the arch of the palate, if it is high, that is usually seen in Marfan syndrome. The natal teeth, if teeth is present in the baby or not, we need to see. Another thing is Epstein pearls. This is small white epithelial cyst along the midline of the hard palate. In the hard palate, if you can see small white cyst along the midline. So that is known as Epstein pearls. If the tongue is large and protruding, that is usually seen in Down syndrome babies. Receding chin on the lower jaw, you can see receding chin, that is known as micrognathia. Then profuse salivation or drooling is a problem. Next is candidiasis. It is also known as oral thrush. It is a white adherent patch on the tongue, palate and buccal surface. We should not try to scratch it out. You have to apply ointment under the physician's description. Then tongue tie. This is what is tongue tie. So later on problem may come for their vocalization. So tongue tie need to be corrected. Neck and shoulder. Normal baby's neck will be short, thick, usually surrounded by skin folds. Something which is torticollis or wry neck. You can see in this baby, head is held to one side with chin pointing to the opposite side. So this is known as wry neck or torticollis. If there is resistance to flexion of the neck and shoulder, then that also indicates problem. Fractured clavicle is there or not, you have to see. If clavicle fracture is there, you can hear a crepitus. Excessive skin fold you can observe for Down syndrome baby. Down syndrome baby are also known as 21 trisomy. And you have to observe for any cyst or mass in the neck. Next is chest. Breast enlargement is normally seen in all the babies, but if sternal retractions are there here, sternal retractions, that is a problem. Supernumerary nipples, if one more extra nipple is there, that is an abnormality. Usually it is associated with a kidney problem, so needs investigation. Secretion of milky substance from the breast, it's also something abnormal but not of much issue. It is known as witch's milk. And if the child is having wheezing, the child need to be taken care. Next, lungs. Respirations are chiefly abdominal. We can see the abdominal movements while the baby is breathing. Cough reflex is absent at birth, and irregular rate and depth of respiration you can observe. The rate and depth of respiration is irregular. Abnormality, if there is apneic spell, breathing is there and repeatedly apnea is there without any breathing, it's there and it is lasting for more than 20 seconds, that is a problem. Another problem is seesaw respiration. Seesaw respiration means in inspiration the chest wall is retracting and abdomen is rising. During inspiration the chest wall retracts and abdomen rises. So that is a type of paradoxic respiration. So that is an abnormality. And if you are observing unequal breath sounds also, that is a problem. So these are the problems in lungs. Heart. The apex beat you can locate on the fourth intercostal space. As the child grows, it is in the fifth intercostal space. For a newborn, the apex beat is at the fourth intercostal space. Then abnormalities. Sinus arrhythmia, that is heart rate increase with inspiration and decrease with expiration. That's a problem you need to look for. Transient cyanosis on crying or straining. When the child is crying, the child is getting blue. That is a problem. Dextrocardia, that is heart is located on the right side. That is a problem. Persistent central cyanosis. I already told acrocyanosis, that is the extremities are becoming blue, that is not an issue for a normal newborn, it is common. But if central cyanosis is there, that is problematic. Abdomen. Abdomen is the normal features we will see. It's cylindrical in shape. The liver is palpable 2 to 3 centimeters below the right costal margin. The spleen is, that tip is also palpable at the end of first week of age. Kidneys are palpable 1 to 2 centimeter above the umbilicus. So these are all common or the normal features. If we are palpating the liver, spleen and kidneys, it is okay. Umbilical cord, that is bluish white at the time of birth, and the number of arteries and vein you need to know, 2 arteries and 1 vein. If umbilical hernia is present, that is an abnormality. If unusually thick umbilical cord you are finding, it is an abnormality. You have to check for any absence of bowel sound. Liver and spleen is enlarged is a problem. Ascites is a problem. Scaphoid or concave abdomen. So scaphoid means boat shaped. So this abdomen is a problem. Distended abdomen is also another problem. Then if umbilical cord is moist, it should be dry. If it is moist, that is a problem. Presence of one artery in the umbilical cord is a problem. Arteries should be 2 in number. Urine, stool or pus leaking from umbilical cord or cord insertion site. If urine, stool or pus is leaking through the umbilical cord or the cord insertion site, it is a problem. Omphaloscele or gastroschisis, that means the protrusion of abdominal contents through the abdominal wall or cord. First picture is omphalocoele. So here one covering, one sac is there, and through the umbilical cord the abdominal contents are outside. Next is gastroschisis. The intestines are coming outside, usually through the side of the abdominal wall, but it is not covered. Both these things are surgical emergencies, omphalocele and gastroschisis. Groin region, you have to see for the femoral pulses. Both are equal bilaterally, you need to check. If absent of weak femoral pulse, it is something to be considered. And inguinal hernia also we need to check. Male genitalia. The urethral opening at the tip of the glans penis. Urethral opening is covered by prepuce. So the urethral opening, it is at the tip of the glans penis, and the urethral opening is covered by prepuce. That is normal. And there will be inability to retract the foreskin in a newborn. That is also a normal feature. Testis is palpable in each scrotum. And scrotum, and whenever you are palpating, it should be softly palpated. The scrotum usually is large, edematous, it looks pendulous and covered with rugae. Rugae is something that like lines which is seen in the scrotum. And erection or priapism for a short period of time is also a normal feature in newborn. This is something known as epithelial pearls. It is an abnormality. It's a small, firm, white lesion at the tip of prepuce. Epithelial pearls. Another pearls we studied, that is Epstein pearls, that was in the mouth. This is epithelial pearls. Testis is palpable in the inguinal canal, then that need to be considered and it's a problem. Hypospadiasis. So here two terms, hypospadiasis and epispadiasis. Hypospadiasis means the urethral opening at the lower side or the ventral surface of the penis. And if the urethral opening is at the upper side or the dorsal surface of the penis, that is known as epispadiasis. Usually with hypospadiasis there is a condition which is known as coding. That curvature of the penis, ventral curvature of the penis is known as coding. Testis, if it is not palpable in scrotum or if testis is in inguinal canal, that needs immediate attention from the physician. Hydrocele, fluid present in the scrotum is known as hydrocele. That is the problem. Ambiguous genitalia, we are not able to distinguish seeing the genitalia whether the child is male or female. Bladder atrophy, so here the bladder is outside the abdomen. This is bladder atrophy, which is also a surgical emergency. Female genitalia, the labia and clitoris are usually edematous and bilaterally they are separated labial folds. You can see there is separation. Then abnormalities, pseudo menstruation or blood tinged or mucoid discharge you can observe, that may be because of the maternal hormones. Then fused labia is a problem. Absence of vaginal opening is a problem. If meconium is coming from vaginal opening, that is a problem. Ambiguous genitalia and bladder atrophy, problem in both males and females. Back and anus. If the spine is intact, there is no opening, no masses, there is no problem. And you need to check for patent anal opening. So here, if anal fissure or fistula is there, that is a problem. Imperforate anus, there is no opening of the anus. So imperforate anus is a problem. Surgical emergency. Absence of anal reflex. Anal reflex means external anal sphincter will contract when we are stroking the skin around the anus. So if that reflex is absent, that is a problem. Tuft of hair along the spine, that may indicate some spinal abnormalities. So it need to be considered. Spina bifida, the spinal contents are coming outside. So these are the problems with back and anus. Musculoskeletal, if no abnormalities, it's fine. There are certain problems like Erb's palsy. So here the child's hand will be like a waiter's tip. Then another problem is clumsy palsy. That is, the problem is with the 7th and 8th cranial nerve. So here you can see the baby's hand will be like a claw. And next is hip dislocation. Hip dislocation can be ruled out with the help of two tests, which is known as the Otto-Lani test and the Barlow test. I will tell you how to do the test, but experts only need to do the test. Being a novice nurse, please don't go for doing this test in a normal newborn. First we have to do the Barlow test. So some terms you need to keep in mind. You need to flex and adduct. The term is adduct. Adduct means you have to bring close. So flex and adduct the hips. You have to flex and adduct the hips. That means you need to bring the thighs towards the midline. Bring the thighs towards the midline first. Then you need to apply pressure. Light pressure should be applied on the knee. Direct the force posteriorly. Apply light pressure on the knee. Direct the force posteriorly. So what happens is, the femoral head dislocates from the acetabulum. So here it was correct. Here once we are doing the Barlow test, the femoral head is dislocated from the acetabulum. So this is Barlow test. Then once the Barlow test is done, you have to confirm the diagnosis of hip dislocation with the help of Otto-Lani test. So Otto-Lani test, how to do is, here hips are examined one at a time. That is a point you need to keep in mind. Hips are examined one at a time. Here also you have to flex the hips and knee. Flex the hips and knee at 90 degree. You need to flex the hips and knee at 90 degree, and the thigh is gently abducted. The term is abducted or moving outwards. In Otto-Lani test we are moving outwards or abducting. So here you can see, because of Barlow test, the dislocation has occurred, and when you are abducting, what happens is that the femoral head reduces into the acetabulum. It will come back into the acetabulum. The femoral head comes back to the acetabulum. And also you can hear an audible cluck sound when you are doing a Otto-Lani test. So first you have to go for Barlow test, then move to the Otto-Lani test. Barlow test, you are adducting and the femoral head dislocates. And in the Otto-Lani test, you are abducting and there the femoral head reduces into the acetabulum. Next is about the extremities. You have to count for 10 fingers and toes, full range of motion, creases on the anterior 2/3 of the sole. You can see the creases on the foot. Sole is usually flat, and symmetry of the extremities you will be checking. The problems are, one is polydactyly. Polydactyly means extra digits. The number of digits are more. That is polydactyly. Syndactyly means like a frog. All the fingers are webbed together or fused together. That is syndactyly. Phocomelia as seen in this picture. Phocomelia is hands or feet are attached close to the trunk. Phocomelia, hands or feet are attached close to the trunk. Hemimelia, there is absence of the distal part of the extremity. The distal part is absent. Maybe the bone will not be there. It is hemimelia. Then transverse palmar crease. So this is also known as simian crease. So for normal baby, number of creases will be there. This is a single crease. This is transverse palmar crease. It is seen in Down syndrome babies. Then fracture or is there or not, you have to see in extremities, and decreased or absent range of motion. And one last thing is talipes. So this is club foot. The change in position of the symmetry of the extremities, you can see this is known as club foot. This is all about newborn assessment. Check for newborn reflexes in the other video. Thank you for watching, and please do subscribe for more videos on nursing.